We're back with the 7 secret causes of nerve pain. Okay, last video we went over the ileocecal valve, valves of Houston, blood sugar check with 3 fingers under the middle part of the clavicle. The clavicle is the collarbone. And then we also checked protein utilization by pulling some hair here, protein utilization. And we checked rib torque by putting our 5 fingers here on the manubrium and then twisting to the right, twisting to the left, and seeing if the strong indicator muscle would go weak or not. Go ahead and lie on your back. We'll check a few other ones, Yvette. Okay. Just trying to get some nice doctorly beep sounds. So the psoas muscles are related to the kidneys, and every gland or organ in the body is also related to a different muscle in the body. Okay? There's all these different interrelationships in the body. So we're going to check to see if Yvette's psoas muscles are balanced. As you can see, the legs turn in evenly. If the muscles were to turn in like this, that would mean that she would have a weak or loose psoas on the left and a tight or over-facilitated psoas on the right. It just so happens that she doesn't. She's got a nice balance to her psoas muscles. Okay. Now we're going to test the actual psoas muscles. Why don't we do that? Okay. Push straight up into my hand here, breathing. Okay, that left psoas muscle's not quite blocking properly. And push up here. And the right psoas muscle's not blocking in place properly. So almost anything could cause that. Maybe a person could have been exercising for 3 or 4 hours and then they come here and then they're just exhausted and they can't have enough energy to get their muscles to come up right. Yvette, were you just exercising for the last 3 or 4 hours, doing vigorous exercises, and are you so exhausted that you're not able to get the muscles to come up?
No.
No, so it's not that. It could be that the person is dehydrated, and because they're not drinking enough water, it's causing both psoas muscles to be what seems to be balanced, but they're actually just both weak. So anyway, there's a lot of different things that could cause it. That's not really the purpose of this video. I'm just trying to go over 7 secret causes of nerve pain that your healthcare provider definitely doesn't want you to know about, because if you knew about it and you're able to address them, the nerve pain would go away and then you wouldn't need their help anymore. So this doctor's probably smart and doesn't want you to know about that. Go ahead and push up into my hand here, breathing. Okay, and this one's also failing to lock in place. Were you ready? Okay, try again. Push, push. Okay, good. So, okay. Now I'm going to put my hand here. Go ahead and push your legs up into my hand, breathing. Okay, and then that's checking for something called cardiac low back. Cardiac low back comes from Dr. Viktor Frankl, who wrote Total Body Modification. That's this technique here. So, and now the company's owned by somebody named Kevin Millay, who's working out of Utah. Dr. Viktor Frankl passed away about 6 or 7 years ago. Okay. So, there's a lot of different things that can cause nerve pain, but I was going over the 7 secret causes of nerve pain. Oftentimes people will have a bone out of alignment called the first rib, which is either on the right or the left, or it could be both of them. And when that bone is what's called subluxated, meaning it's not dislocated, where they need to go and get a cast or have a surgery, but it's less than dislocated, it's subluxated. So it's out of alignment, it's causing interference with the nerves, it could be impinging upon a nerve, and that can cause nerve pain. It could be any bone. It's just very, very, very common for it to be the first rib on either side. So we could just palpate, meaning touch with a little bit of force, Yvette's first ribs on both sides. And she's lucky. she doesn't seem to have the first rib out of alignment. A lot of people do. Okay, so this is a whole language that we're able to use to communicate with the body with. So for instance, I can look at Yvette's leg lengths and see, are they even or uneven? And if they're uneven, do they change when she goes from lying on her back to lying on her stomach? And if they do, that gives more information about the body. if she had a short leg on the right, for example, and the short leg got shorter and the long leg got longer, that would demonstrate that she has her occiput out of alignment. That's actually part of the skull. If when the short leg on the right and the got more even, and it almost seemed like the legs were even when she lied on her stomach, that would be indicative of the atlas, which is the first bone in the neck. The atlas is the bone that holds up the skull. That's right underneath the skull. That bone would be out of alignment. The main movement that the atlas allows for is rotation, right and left rotation. Okay. So I had this one patient who'd had neck pain for, I think it might have been 7 or 8 years, and we did a few chiropractic adjustments and their neck pain was gone. I mean, it was gone. And they'd already been to a number of different chiropractors, but the chiropractors didn't really have the right training and skills to address what was causing their neck pain. It's kind of interesting. I've had that happen with a number of different patients, actually. So a lot of people say, I've had these chronic neck issues for all these years. Nobody ever was really able to diagnose that their neck issues might be related to their thyroid gland, which is in the neck. And so thyroid has to do with all these emotional imbalances and blood sugar imbalances and all these different things. So if nobody's addressing proper thyroid function and nobody's addressing the proper digestion, which I mentioned in an earlier video, also can lead to neck pain, then the person might feel better after they see a chiropractor who realigns the structure, but it's only a short-lived improvement because they're never addressing the underlying causes of the neck pain. So the same thing with any nerve in the body that could be impinged upon. Very often people will have a sciatica, like a pain that goes down one leg or the other, and it's just it's so bad that they can't really, they're just not happy. And so that sciatica is actually often due to a nerve impingement. But the thing that's causing the nerves to be impinged isn't just the structures out of alignment. It's actually a dietary problem in many instances that then irritates, that causes the muscles to become imbalanced, that irritates the nerves, and that causes the nerve pain. This is a well-researched thing. So I know it's maybe new to you, and that's one of the reasons why you're watching this, is because what you've been doing hasn't been working so well, and that's why we're going over these new ideas and new ways of doing things that are really revolutionary. I mean, this is the most advanced method of diagnosis and treatment in the world of modern therapeutics, and it's just absolutely phenomenal. So it's the most cutting edge thing that there is. So we've seen literally had cancer patients that were told that they had to get organs or glands removed, like the thyroid removed or a hysterectomy, and after 2 or 3 visits we would see literally all their cancer cells would be gone from their body. And that's on ultrasound and through other labs and other testing. So thanks for watching these videos. I hope you found them helpful. Again, my name is Dr. Ilya Skolnikov. This is Yvette. We were happy to bring you this information, real excited about it. And we look forward to getting a chance to check your body points and check your circuits, the 7 secret causes of nerve pain, to see if we can just get rid of the nerve pain for good. Okay, thank you.